Thank you for taking time out of your busy day to learn about vital sign measurement. This is an important skill for you to acquire when working with seniors. Vital signs will include readings of temperature, pulse, respirations, and blood pressure. Now, during the course of this video, we're also going to discuss weighing our residents. Now, weight is not a vital sign, but it's another important piece of information for you to share with the medical professionals caring for your residents. Vital sign measurement helps give important information to the resident's physician. There can be many changes that take place with our resident, and having an accurate vital sign measurement will ensure that the physician is providing the best care possible. Vital signs may change when a resident is in pain, has an infection, or perhaps an adverse reaction to a medication, just to name a few. The body temperature of a person can vary depending upon their age, gender, recent food consumed, etc. The American Medical Association defines normal body temperature between 97.8 degrees and 99 degrees Fahrenheit. Fever is defined as an abnormal body temperature for that resident. There are a variety of conditions that can cause an elevated temperature, including infection. Now, it's important to never measure the severity of the illness based solely upon the temperature reading. For example, influenza may cause the temperature to spike upwards of 104 degrees. Yet a resident could have a severe pneumonia and only have a slightly elevated temperature. That's why it's important for us to take the temperature reading and report it to the physician for analysis. There are several ways to obtain a temperature reading. The first method we are going to discuss is an oral reading. There are different tools that can be used, including the traditional glass thermometer. However, we must be very aware of safety concerns when using an oral thermometer with our residents. Our residents that have any impulse control issues or confusion, for example, our residents with dementia, would be at significant risk if they bit down on a thermometer. That's why we have tympanic and other thermometers that are actually more safe to use with our residents that have any level of confusion. Let's talk now about obtaining a temperature reading orally. There should not be anything hot or cold in the resident's mouth for 10 minutes before taking the temperature. It's important to always use the manufacturer's recommended probe covers. That way we do not spread infection within our community. Ask the resident to open his mouth, put the covered tip under the tongue. Ask the resident to close their lips gently around the thermometer. Keep the thermometer under the tongue until the digital thermometer beeps. Remove the thermometer when the number shows up in the window. Read the numbers in the window and document. Remove or eject away the throwaway cover. Disinfect using proper protocol. Place the thermometer back in its holder. Remember to always follow manufacturer's instructions. We are now going to discuss the use of a glass thermometer. Rarely are these used in communities, but we're going to cover the instructions just in case you would have a need to use one day. Once again, there should not be anything hot or cold in the resident's mouth for 10 minutes before taking the temperature. Take the thermometer out of its holder. Be sure to inspect it to make sure that there's no nicks or cracks in the thermometer. Hold the thermometer by the end opposite the colored tip. Clean the thermometer with rubbing alcohol. Rinse with cool water. Turn the thermometer in your hand until you see the colored line. Sometimes the line is red, blue, or silver. The line should read less than 96 degrees Fahrenheit. If the line reads more than 96 degrees Fahrenheit, firmly shake the thermometer downward several times. Shake the thermometer over a couch or bed. This will keep it from breaking if it slips out of your hand accidentally. Ask the resident to open her mouth. Place the end with the colored tip under her tongue. Ask the resident to gently close her lips around the thermometer. Remind the resident to not bite down on the thermometer. Keep the thermometer under the tongue for 3 minutes. Remove the thermometer without touching the tip. Gently wipe the thermometer with a tissue. Slowly turn the thermometer until you see the colored line. Each long mark on the thermometer is the same as 1 degree. Short marks are the same as 2/10 of a degree. Let's take some time now to look at some screens. Can you read the temperature properly on these thermometers? Wash the thermometer with soap and water and disinfect following your facility protocol. Do not use hot water as it could break the thermometer. We're now going to talk about obtaining a temperature reading using the ear, also known as a tympanic reading. As these devices have become more affordable, you'll often find ear thermometers, as they're often called, being used in the home as well as in communities. This is one of the most common ways we obtain a temperature reading with seniors. Not only is this reading very accurate, but it's less invasive as well, and of course protects the resident's dignity. There are many kinds of ear thermometers. Carefully read the instructions before using your thermometer and always follow manufacturer's instructions. Take the thermometer out of its holder. Put a throwaway cover over the tip of the thermometer. Instruct the resident not to move her head. When measuring an adult's temperature, gently pull the ear up and then back. Put the covered tip into the ear opening. Do not use force or push hard. Press the button to turn on the thermometer. Hold the button until the thermometer beeps. Remove the thermometer from the ear opening. Document the temperature reading. Remove and discard the throwaway cover. Again, a reminder, always follow the manufacturer's specific instructions for the device you will be using. It is very rare that you will be asked to obtain a rectal temperature. Always receive resident-specific training from your medical professional before performing a rectal temperature reading. Our next vital sign reading is pulse rate. This is the number of times the heart beats per minute. There are several factors that can influence how fast a heart beats, including if the resident has just exercised or is under stress or has been resting. When obtaining the pulse rate, you are going to learn how to count the pulse rate. Now, medical professionals also learn how to assess other things about the pulse, including strength or regularity of the pulse reading. During this training, you will learn to count the beats per minute. A normal healthy adult has a heart rate between 60 and 100. It's important when taking the vital sign readings of a resident that you know what is normal for that resident. Some seniors may have a normal heart rate outside of those parameters. An abnormal heart rate is one that is either too slow or too fast. If a resident has an abnormal heart rate, you will want to report that immediately to your supervisor or the resident's physician as indicated. Generally speaking, if the heart rate is below 60 or above 100, it is a concern for us. Always know the appropriate parameters for your residents and follow your community guidelines. Anytime you have an abnormal pulse accompanied by tightness in the chest or shortness of breath or extreme fatigue, that would be an immediate 911 medical emergency. So let's talk about obtaining the pulse reading. As the heart forces blood through the arteries, you feel the beats by firmly pressing on the arteries, which are located close to the surface of the skin at certain points of the body. As indicated on the screen, the pulse is often palpated between the bone and tendon on the wrist. Use the first and second fingertips. Press firmly but gently on the arteries until you feel a pulse. Begin counting the pulse when the clock's second hand is on the 12. Count your pulse for 60 seconds. When counting, do not watch the clock continuously, but concentrate on the beats of the pulse. If unsure about your results, ask another person to count for you and document. Remember some important points about obtaining pulse readings. Don't press too hard or you'll obliterate the pulse rather than be able to read the pulse reading. Never use your thumb, or you know what? You might be recording your own pulse instead of the resident's pulse. Relax. Take your time in locating that pulse. Sometimes it takes a couple of minutes to find that pulse. The more you practice, the easier it will be. When taking a pulse on the neck, never feel both sides at the same time. That's a dangerous maneuver. Always feel for one side at a time. Respirations is measuring the number of breaths per minute. Most residents will breathe between 15 and 20 times per minute. If a resident is breathing 12 or less times per minute, that is of significant concern, as is if the resident is breathing 25 breaths or more per minute. That should be immediately reported to the resident's physician and your supervisor. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises. If you have difficulty visually making a count, you can gently rest your hand on the chest and count. It's natural for any of us when someone is watching us breathe that we might breathe at an abnormal or different rate. That's why it's very common when counting respirations to begin doing so immediately after counting the pulse. Leave your hand in place and just move your eyes up and gently watch the chest as you count the respirations. That way the resident is actually unaware you're even counting their respirations at that time, and you'll get a more accurate reading. The next vital sign reading we are going to discuss is blood pressure. You're going to need two tools to obtain this reading. One is a stethoscope, and the other is a blood pressure cuff, also called a sphygmomanometer. Two numbers are recorded when measuring blood pressure. The higher number, or systolic pressure, refers to the pressure inside the artery when the heart contracts and pumps blood through the body. The lower number, or diastolic pressure, refers to the pressure inside the artery when the heart is at rest and is filling with blood. Both the systolic and diastolic pressures are recorded as millimeters of mercury. New guidelines now define normal blood pressure as follows for adults: less than 120 systolic pressure and less than 80 diastolic pressure. High blood pressure or hypertension directly increases the risk of coronary heart disease, heart attack, and stroke. With high blood pressure, the arteries may have an increased resistance against the flow of blood, causing the heart to pump harder to circulate the blood.